Different than a lot of neonatologists, I spent 3 years as a general pediatrician. So I was here in town in the children's clinic for 3 years, and that was an interesting experience, and that added a lot to my experience, and it kind of made it a little different than most neonatologists. And then I went back, moved my family, my young family, and went up to Nashville to Vanderbilt and did my 3-year fellowship. I think that the general pediatric experience, the clinical experience, in some ways I think I've benefited. Neonatology is quite different though, the intensive nature of it. But we do a lot of interacting with mothers and families, in which my general pediatric background is quite helpful. And we, in our practice, take care of the healthy newborns as well. One of the most important things I think that I do is to help mothers to realize that they need to take care of themselves. Oftentimes a mother's instinct is to stay near the baby, and they've just had a cesarean section, or they've gone through a difficult delivery, they've had great emotional upheaval, they probably have children, family at home, and they need to take care of themselves, because if things turn out as we all hope, at some point down the road, they're going to be the primary caregivers, and they need to be healthy. So one of the hardest things to do is to convince a mom to be a little bit selfish in those days in order to preserve themselves for when they're really most going to be needed. As a neonatologist, my role is to take care of babies, and so from the largest, happiest, healthiest baby to the tiniest, smallest baby. Each has his or her needs, and my role is to provide that and to help that baby to become as healthy and normal as it possibly can be.